Hello friends. If you are paying $202.98 every month for Medicare Part B in 2026, there is a state-run program that may pay that premium for you. That is $2,434.80 a year that many seniors are losing from their Social Security checks without ever checking whether they qualify for help. This is not a rebate card, a new stimulus check, or money that Medicare automatically deposits into your account. It is called a Medicare Savings Program, and depending on your income, resources, and state rules, it may pay your Part B premium. One program may also protect you from Medicare deductibles, coinsurance, and co-payments. The most important part is this. Medicare itself says you should apply even if you think your income or savings are too high, because some states use higher limits or do not count certain income or resources the same way. Today, I am going through 6 things every Medicare beneficiary needs to know. What the monthly premium really costs over a year, what QMB pays, how SLMB and QI work, the 2026 federal income limits, the extra prescription drug help that comes with approval, and the exact words to use when you call your state. Before we get into it, subscribe to this channel right now and turn on the bell. Medicare premiums, income limits, state programs, and application rules can change every year. Medicare will not personally call every senior and say you may no longer need to pay this bill. The people subscribed here learn what to check before another year of premiums disappears. The people who are not subscribed often discover the program after paying thousands of dollars they might have been able to keep. Subscribe now, and let's get into it. Program number 1. Understand what the Part B premium is costing you. The standard Medicare Part B premium in 2026 is $202.90 per month. Multiply that by 12 months and the annual cost is $2,434.80. For many people, this amount is deducted from Social Security before the check reaches their bank account. A person receiving $1,700 per month may look at the deposit and think Social Security simply pays less than expected. But a large part of the difference may be the Medicare premium. If a Medicare savings program begins paying that premium, the person may eventually see more of the Social Security benefit deposited each month. Or Medicare may stop sending the premium bill if the person pays directly. The exact timing depends on the state and how quickly the systems update. Look at your Social Security benefit statement, your Medicare premium bill if you receive one, or your My Social Security account. Find the line showing the Part B premium. Then call and say, I pay $202.90 per month for Medicare Part B in 2026. I want to be screened for every Medicare savings program available in my state. Please tell me how to apply and what documents I need. Program number 2. QMB can do much more than pay the monthly premium. QMB stands for Qualified Medicare Beneficiary. This is the strongest of the Medicare savings programs for most older adults with limited income and resources. QMB can pay your Part B premium. If you do not receive premium-free Part A, it may also help with the Part A premium. More importantly, it protects you from Medicare deductibles, coinsurance, and co-payments for Medicare-covered services and items. In 2026, the standard Part B deductible is $283. After that, deductible original Medicare commonly leaves the patient responsible for 20% of the Medicare-approved amount for many Part B services. Imagine you pay $2,434.80 in annual Part B premiums, the $283 deductible, and $1,000 in coinsurance during the year. That is $3,717.80. A qualifying QMB beneficiary may be protected from those Medicare covered. There is also an important legal protection. Medicare providers are not allowed to bill a QMB beneficiary for Medicare deductibles, coinsurance, or co-payments on covered services. A small Medicaid copayment may apply in some situations, but a provider cannot simply ignore QMB status and send the normal Medicare balance. The 2026 federal monthly income limit shown by Medicare is $1,350 for one person and $1,824 for a married couple. The federal resource limits are $9,950 for one person and $14,910 for a married couple. If you have QMB and receive a bill, call the provider and say, "I am enrolled in the Qualified Medicare Beneficiary Program." Federal billing protections apply to Medicare-covered services. Please verify my QMB status and remove the prohibited Medicare cost-sharing balance. Keep your QMB or Medicaid card and show it together with your Medicare card whenever you receive care. Program number 3, SLMB may pay the full Part B premium even when you do not qualify for QMB. SLMB stands for Specified Low-Income Medicare Beneficiary. It pays the Medicare Part B premium. It does not provide the same broad deductible and coinsurance protection as QMB, but eliminating the monthly premium is still worth $2,434.80 in 2026. The federal monthly income limit is $1,616 for an individual and $2,184 for a married couple. The listed resource limits are $9,950 for an individual and $14,910 for a couple. Here is why this matters. A senior may look at the QMB limit of $1,350, see that their income is $1,500, and stop reading. That person may still be under the SLMB limit and may still qualify to have the entire Part B premium paid. Do not ask only whether you qualify for Medicaid. Ask specifically to be screened for SLMB and every Medicare savings program. The names used by a state can vary, and a front desk worker may not automatically explain each category unless you ask. Use this exact question. My monthly income is approximately $, and I have Medicare Part A and Part B. Please screen me for SLMB as well as QMB, QI, and any state Medicare Premium Assistance Program. Program number 4. QI reaches people with somewhat higher income, but you must act early. QI stands for Qualifying Individual. Like SLMB, it helps pay the Part B premium. In 2026, the federal monthly income limit is $1,816 for an individual and $2,455 for a married couple. The resource limits are again $9,950 for one person and $14,910 for a couple. QI has 2 important rules. First, you must apply every year to remain in the program. Second, states approve QI applications on a first-come, first-served basis, with priority generally given to people who received QI benefits during the previous year. That means waiting until the end of the year can be a costly mistake. A single person with monthly income of $1,750 may be too high for the federal QMB and SLMB limits, but still below the federal QI limit. If approved, that person may save $220.90 every month. Call your state and say, "I want to apply for the 2026 Qualifying Individual Program." Is funding still available? What is the application deadline? And what must I do to renew for 2027? Write down the date, the representative's name, and the documents requested. Program number 5. The federal limits are not always the final answer. Medicare publishes federal income and resource limits, but your state makes the eligibility decision. Some states use higher income limits. Some states disregard certain amounts of income. Some states do not apply the federal resource test in the same way or may not count resources at all for certain programs. Resources can include money in checking, savings, or retirement accounts, but the details vary. This is why you should not reject yourself based on one number found online. The limits are also slightly higher in Alaska and Hawaii. Suppose your monthly income is $1,900 as a single person. That is above the federal QI figure of $1,816. It would be easy to assume you cannot qualify. But Medicare specifically tells people to contact their state and apply even when income or resources appear higher than the federal amounts. Your next step is not to guess. Your next step is to request a formal screening. Say, I may be above the federal limit, but Medicare says state rules can be different. Please process a full Medicare Savings Program application and explain which income and resources your state counts. Do not accept "you probably do not qualify" as a final decision. Ask for the application or a written eligibility determination. Program number 6. Approval can also unlock extra help for prescription drugs. If you qualify for QMB, SLMB, or QI, you automatically qualify for extra help with Medicare prescription drug costs. In 2026, a person receiving this help pays no more than $12.65 for each drug covered by the Medicare drug plan. And some people pay less depending on their level of assistance. Imagine you take 4 covered brand name prescriptions every month and would otherwise pay $50 for each one. That is $200 per month or $2,400 a year. At $12.65 each, 4 monthly prescriptions would cost no more than $50.60 per month or $607.20 a year. The difference in this simple example is $1,792.80. Combine that with the $2,434.88 Part B premium, and the total potential annual difference can exceed $4,200 in a case like this. Approval for one program can therefore affect both the medical premium and the pharmacy counter. When you apply, ask, if I am approved for a Medicare savings program, when will my automatic extra help begin? And how will I know my drug plan has updated my copayments? If your drug costs do not change after approval, call your Part D plan and 1-800-MEDICARE at 1-800-633-4227. TTY users can call 1-800. Now let me give you the complete application checklist. First, contact your state Medicaid office because the state runs Medicare savings programs. If you do not know the number, call 1-800-MEDICARE and ask for the correct state contact. You can also contact your state health insurance assistance program, known as SHIP, for free personalized counseling. Second, gather proof of income, your Medicare card, Social Security information, bank or retirement account statements requested by the state, and information about your spouse if you are married. Third, ask to be screened for all 4 programs, not only ordinary Medicaid. The 4th program, QDWI, is mainly for certain disabled people who returned to work and lost premium-free Part A. It pays Part A premiums rather than the standard Part B premium. 4th, save a copy of the application and record when it was submitted. 5th, keep checking your Social Security deposit or Medicare bill after approval. System updates can take time. Ask your state when the premium payment should begin and whether any amount paid after your effective date will be returned. So here is the full picture. The standard Part B premium is $202.90 per month. In 2020, $434.80 a year. QMB may pay the premium and protect you from Medicare deductibles and cost sharing. SLMB and QI may pay the Part B premium for people with higher income than the QMB limit. State rules may be more generous than the federal numbers, and approval for QMB, SLMB, or QI also brings automatic extra help with prescription drug costs. This help does not arrive simply because Medicare knows your income. You must apply through your state. The difference between paying another $2,434.80 and keeping that money may be one application you have never been told to submit. Subscribe, share this with someone you know who is on Medicare, and I'll see you in the next one.